Finding the Voices.
Talk show by Monica Igudam.
I'm a huge fan of Finding the Voices.
You're doing a great job for Manipur.
Manipur bu prithivida masatak pa
good positive voices and make those voices more visible.
We wanted our voice to reach in all the corners of the world.
Interesting people.
Been finding voices on
people from our own place.
Share positive stories and inspiring stories and bring out the good stories of Manipur.
Finding the Voices.
Welcome to Finding the Voices. Right now we are at the residence of Dr. Nabakanta Sharma, who is specialized in family planning and currently working as a visiting professor at Kathmandu University. Welcome to our show.
Right, thank you, Monica.
So today I was very interested to read about your profile. Specifically, wanted to learn a little more about the family planning, reproductive rights in Manipur. To start with, can you please share about your childhood, growing up phase?
Yes, thank you very much, Monica. Actually, I'm honored to be with you this wonderful evening. Actually, I was born in a very poor family, a Brahmin family, so-called Brahmin. I don't know why my father say you are Brahmin. I say yes. So actually, I'm not very sort of a fanatic in religion and all.
Okay.
Our family was very poor. We have got 4 brothers and 2 sisters, and I'm the eldest. My father says, "Look, you're my eldest son. You must be helping me. You should help me, and you should go to education, and you should be someone." I say, right, that I was struggling. I start my schooling from Petrigu LP school, lower primary school. I complete up to class 2. Then I shifted to Marangkom ME, middle education, I don't know, ME school. Then I shifted to Ramlalpal High School, one of the pioneer high school in those days. They produce, must be around hundreds of doctors and engineers, and some of them IAS also. So I think my molding, my childhood mold was given by the Ramlalpal High School, and I really indebtedness to that particular school. And I do remember Sir Padma Kumar, Sir Shitaljit, Sir Madhu Chandra.
So they were like your mentor idols.
Yes. They really, I don't know, but somehow in those days we have got a very highly disciplined. We touch the door, and the sir, can I come in? And we are so much disciplined. Unlike hi, hello. So of course I'm not telling that we are not that much of civilized, but that was very highly disciplined curriculum was there. We respect our teacher, and my father come to the school also and talk to the headmaster, the late Shitaljit, and I say, "Oh yeah, your son is mediocre. I hope he can achieve something." Yeah, he said, I'm not very good in education. I play around. I do love to see English movies in those days, and the Sophia Loren and Masrani, and I was fascinated about Rome and the Vatican cities, photograph, the making of the Adams and all. Of course, at the later of my life, I spent 1 year, and I keep on going to Italy also, and Florence and Bombay.
So you were focused in other extracurricular activities too.
Of course, I do read. I am very good in science and mechanics.
Okay.
Science and mechanics was very good. I still remember Boyle's laws also, and although it is around 40 years, I still remember the equation and all. But I do love to see
So
English.
You had a balance of studies as well as other activities.
Exactly. That was my childhood, and yes, by the grace of the God, then I went to completed my this thing, 1967 matriculation, then the DM college, then the pre-medical to again the outside Manipur. Then there was a selection come up, and I was selected to be. I was a little bit higher side in the select merit list, and I was selected for the King's Medical College of Lucknow, and that was very prestigious and one of the brilliant 1 or 2 medical colleges in India. And I told you, because my father was a very poor Brahmin, he doesn't have much money, and he told me, son, I know you got a very good this thing, and I admire your hard work, but look, if you go, I have to pay the money for your travel and the money, and I'm hard at Manipur. Just started a medical college. Why don't you do India? I would like to request to one of the director, that NB Roy or something like that. So he went, and they are more than happy, because a lot of
you got selected in Lucknow, but
Lucknow.
you could not afford it, so you had to study in Manipur.
And a lot of others, those who are in the lower side, they are more than happy to go to Lucknow. What is Manipur? That time
because of your high ranking, you got the chance, but you dropped out.
Yeah, because that was it was my tragedy, but it was my destiny. So I could not go there, so I started here with the
which colleges?
In Manipur, now RIMS.
Okay, at that time it's
called Manipur Medical College.
Okay.
It was just started.
Okay.
And
so you are the first
Yeah,
batch.
I was the first batch. Sekurjit was with me, the then director of RIMS, and the present medical superintendent, Dr. Amubo, and all of around 70 to 80% are in a very good job. Even Narula Amritpal is in New York from Manipur, our batch.
No, that's very interesting.
Yeah,
I'm getting to talk to the first batch of Manipur Medical
exactly.
College.
And Narula Amritpal, I would, God willing, if you put it up, he will watch it, and he'll be more excited to mention his name. But of course, in those days, we were very simple. In Lamphel, horses and medical students was there. No soap at all. There was one tea shop was there, a small tea shop. No luxury, nothing of the sort. We eat dal, rice, and a little bit of morning tea, and a little bit of breakfast with omelette, and there was one hotel only. At that point of time, I'm talking about the 70s, early 70s. So I started, and I complete my MBBS. Then one fine day, I was posted to IT Road to Oiwaichong. It is very far away. And there's an epidemic of malaria.
So this is after you became a doctor.
So I completed, because medical study as usual is a hard thing, anatomy, medicine, and other things. Of course, I am a mediocre. I am not a very brilliant. Of course,
I think you're underestimating yourself.
Because I just clear, and then I got it. Then another very interesting, because they posted there. So I have to go by Manipur State Road Transport bus. At the time, that was only conveyance we have got. So I have to climb up, and I went down there, and one villagers, and he take my suitcase and take it to my nurse's home. And she was prepared a nice meal, rice and dal, and perhaps omelette, I believe. I remember faintly. So then I have established my one small quarter, by thatch sort of a thing. Then the next day, one dead body in burning, because there's a Nepalis. So I was a little bit worried. What shall I do now? So I have to go down to the village, and I was carrying chloroquine in my pocket. But my intention was, I want to buy some eggs, because in those days eggs is not selling in the market like in the
you
nowadays.
have to go to the house.
Houses, and so I was a source of egg. Plus, I was just examining the pulses. I just examining the temperature of the patients, the villagers. Many of them having malaria, and I palpate the spleen, and they are suffering from malaria. So I was buying the eggs, and I was giving the chloroquine tablet to the patients. And somehow the more or less epidemic was more or less a little bit slow down. So actually at that time I do not know what I was doing, but I was doing a good thing without knowing it. And people are happy. So after 3-4 months, it's WHO people come, and they are giving some extra instruction. You have to collect the smear blood, and you have to send to Kangpokpi, and you have to report it. And the system was centralized. So I was obliging it slowly. Again, after 4 months or 5 months or so, Manipur Public Service Commission called for recruitment of doctors. So then there was a police this thing ke my father said, come your examination so and so. There was a small police station was there. So I come up with a travel's hall because without saving properly, and I landed to the Public Service Commission. At that point of time, South Indian gentleman was the chairman. They were asking questions about, there's a 2 or 3 doctors also, because they are firing left and right about academic and this thing, and I know I didn't reply well, maybe 50% maybe correct or 60% was correct. Then one fine gentleman, he was asking me, where are you posted now? I say, I'm posted to Aiwaichung. Who is suffering? What is the disease commonly? Malaria is pandemic. There's a lot of malarias and the people are dying, sir. And then who are suffering? Sir, Nepalis are suffering. Other cookies are not suffering very much, but Nepalis are more suffering. Why? I say cookies stay in the hilltop and they have got a fireplace in the middle of their home, so the smoke is there, so mosquito doesn't bite it. The Nepalis are in the near the field, the paddy field, where the water is also there, and they are very fresh from Nepal. They doesn't have the resistance. That's why they died. They are suffer more. Then say, this young boy walk. It seems, he was just joking at me, pointing his finger to me. It seems this boy walk. Okay, and around we apply around 25 or so doctor. Around to be selected 7 or 8. Many of them didn't select. But I'm not very proud. I didn't answer properly. Honestly, I'm disclosing myself. But they know that I was working in the field. That was a good reason I was selected.
Okay.
So that was my turning point of my starting
your
point of
career.
my life. After 2 years or so, my father was a little bit of again hammering me. Your brothers are not doing well. You are earning money. You are staying in this thing, and why don't you come back to somewhere in Imphal and all?
And this is in the early
80s.
Early 80s.
So my father somehow or other he struggled to bring back to Delhi area, and at that point of time, district hospital was a prime posting. So, but I could not. I'm not very influential. I don't have any political background also. So, I was in Imphal, but they posted in the family planning department.
Okay.
It is one of the unwelcome, unproductive, not very encouraging posting. It is not. It is not a very good posting.
Okay. So to backtrack, what was your specialization?
No. Still, I was MBBS.
Yeah. So you didn't have. It was a general.
General sort of a thing.
Okay.
So I was posted in a family planning clinic, and to do some vasectomy operation and to put some intrauterine contraceptive device. I have to put that device to a woman so that she doesn't have the baby for about 5 years or 10 years, whatever she wishes.
Okay.
And for the male vasectomy, I have got three children or 5 children. I don't like to produce more children, so kindly do operation. That was a small minor operation, and this was my beginning.
But what did you want to, like, which department interested you at that time?
Yeah, because my romance, my sweetheart is public health.
Okay.
Public health is my. Of course, I've done my diploma in public health also. I'm a surgeon, I'm a clinician, but still, public health is some doctor doesn't like it because it is something about how many women suffer from pregnancy, how many child died. It's sort of counting. It's a mass. Clinician is dealing man to man. I'm treating you. That is called gynecologist or physician or a surgeon. But public health is treating about whole of the community, whole Lekai, whole state. That was my.
So that inspired you, and you wanted to get into that.
Yeah, because that was. But somehow I tried once or twice, but I didn't select it. My destiny is somewhere. So then
So you got into family planning.
Yeah. That was I was keep on doing. Then the late Dr. Lan Mohan was the assistant director, and I was his blue eye boy because the program for the family planning. I love traveling. I keep on with a small shoe and the one jean and the one t-shirt. I was loitering around.
Because
I
you
got
were
a
young and you
could
easily
I was
go
energetic.
travel.
Yeah, I love traveling. I still love traveling. I just come back from Dubai only few weeks back, and so that was the thing. And yes, coming back to family planning, they went for a training to Bombay. The late Purnimasi, the director of family welfare, also trained for this operation. But after coming back, somehow or other, she could not perform the operation. So then the Lan Mohan say, okay, fine. my son, you go to Hyderabad Osmania Medical College and you learn this technique, and I will give you TAD and all. I say, yes, sir. All the time I say yes, sir. I never say no, sir. When I went there, I learned around 45 days about this technique, laparoscopic tubal ligation. So then I traveled all the primary health center, of Manipur. Parbung, Thanglon, Henglep, Maumram, Tadubi, More, Kasong Kulen, Chingai, Jiribam, then even my Toiwachong, then Tamenglong, Tamai. I was moving all over the primary health centers of Manipur. It's a very, very, very rare quality of a doctor, because I'm sure nobody get this opportunity in none of my colleagues, but of course it was very hectic.
But you were the only one in Manipur who knew how to do that
technique. But I feel crying. After me, these techniques, nobody. Of course, one doctor, young doctor, he started at RIMS, because my friend, I led Idoren, he was doing, he's no more. My friend, Dr. Nonibla, she is almost retired and all. And another young boy in RIMS, he started doing it. But I'm happy. Otherwise, in our state, because again.
No, are you saying at that time or right now?
No, right now.
Oh, really?
Really?
I thought you're telling at that point of time you were the only one.
No, at that point of time, Dr. led Purnimasi, led Lan Mohan, and present Dr. Vilasini, the running practitioner, and myself. We are the few people, but two is no more. Dr. Vilasini also retired, and she has got one clinic.
So this is the procedure to tie the tubes. So that you can plan for the family.
Yeah, because somebody having 6 children, so they keep on doing abortion.
Okay.
So okay, fine, I don't like it. Okay. So kindly do the operation, and the government is giving some money also to take rest for 1 or 2 days.
Okay.
So at some point of time, I know it was not good. I went to Moirang. I have to do 100 women, around 102. Honestly, I start my operation at 7:30. I get up at 5, rest down to Moirang. I do with the 2 instruments. It is completed around this time, 7:30.
Okay, so a lot of people. So it's like a camp.
Yeah. Oh yes,
knows
camp.
And
Oh yes.
That's how you're called in all the different districts all over Manipur.
Exactly. That was I make the century, but it was totally wrong, because government they say don't do more than 20.
Okay, but then there were a lot of people, but very less surgeons who know how to do the technique.
But still very less. Still very less. But that was a blessing in disguise, because I was keep on doing, then I became expert. But still, I am.
You saw the status of
the district. Now still I am going to Surasanpur. I'm leaving on Monday again, because I was appointed sometime for a consultant for the National Health Mission as a gynecologist for family planning. And some of the district medical officers knows I am the only available. And of course, I simply goes. It's not for money. It's now something like benevolent. I just like to do something. My poor women, my sisters, my daughters, they are suffering. They are repeated childbirth. And again, I'm telling you, it's a very simple thing. You women have undergo family planning operation, so-called sterilization operation. She will never ever die in childbirth. Once she is sterilized, there is no flying coffin bringing to the, to the doctor's place, because recently it was happened. So family planning saves women's life.
So you are for family planning.
Exactly. Still, so long my heart is beating, I will do the rest of my life, irrespective of in Manipur, irrespective of to Nepal. I am doing the operation. I went to Mao, I went to Surasanpur. And private, of course, somebody pays some money. Of course, there's some rich woman said, "Sir, kindly do it. I'll pay this much money. Kindly do and come to Imphal hospital or whatever private." That also I'm doing it. But my heart goes more towards the remote area. But unfortunately, some of the so-called social worker they blame that don't do family planning operation.
So there are institutes and other groups who oppose against family planning,
especially in Valley.
Okay.
In the hill areas, nothing of the sort. Not a single word.
Is there any regulation?
Yeah, regulation, of course, Government of India very specifically says, if having 1 or 2 child, they want to do operation, kindly do it. And there's some clinical, some medical contradiction, some heart disease, and the scar in the abdomen, and very anemic women, don't do it.
So the government supports
Exactly.
family planning,
Exactly.
and they even compensate it for the procedure.
You know, India is such a wonderful country. When somebody born a child, government India money give money. If some women say, I don't like to have a child, let me do operation, okay, I'll give you money. Because we are a democratic country. We can do it. But you know, very strangely, Burma is a country where you cannot do family planning operation. I can remove the whole uterus, the tube, I can remove it, take it out as an operation. They will not find me. But if I tie the tube only, I will be in jail.
Okay.
Very strange. Again, Ireland. Ireland is a Catholic country. They cannot do abortion. They cannot do the family planning operation. You know, of course, there's a few small, exceptions are there. But I tell you very frankly, if I go to Moray, if I tell them that all the Burmese people will come and they will give me 5,000 rupees, kindly do the operation. Because their government is not allowing it, and they don't like to have the baby because repeated childbirth is not good for the mother. They cannot afford it also, because they are also coming democracy, and women doesn't like to have more children. They like to have their good education. Now the internet is coming, and everything is coming. So they come to Indian side, and instead of we are in India, we are giving money to the women for the family planning operation. But in Burma, they will come to me and they will love to give money. Kindly do the operation, and I will give money.
So they come to India to get the procedure done.
Yes.
Monica, Finding the Voices.
Finding the Voices.
Finding the Voice.
I could see my father. Who came to meet my headmaster because he was unable to pay the fee. I'm sorry.
Because we need such story for people to have faith in the government, in the system, that yes, it's working. And
Let's bring peace in our home state,
people
Manipur.
who have got the job without bribery, they will do justice to their job, and they will help raise the standard of Manipur.
Me machine create I adu paraga tingogi
since you have had a lot of experience working in Manipur and seeing all the district, seeing all the public, can you share a little bit about the status and level of the people in terms of women's reproductive right, particularly in Manipur?
Thank you very much. It's a wonderful question. Reproductive right is a very, very important and little bit of debatable issue also. But I believe a civilized society should have a very high standard of women's right. And as you know, in Europe and America, women's right is very, very high. Even, they cannot think of divorce because half will take it away. Even your golf player of your America, and even the recent so many, this thing. But coming back to Manipur, we have improved a lot, no doubt of it. So I have seen many women who really get the higher platform and the opportunities in the healthcare and sexual and reproductive life. But unfortunately, we have remote areas called villages, and especially in the hills. If you go about 20 kilometers away down to the village areas, you can see the women are working in the brick field, women working in the constructions, this thing, and especially in hill area, it's really, really difficult. Some of the women never get a chance to see a doctor in their life. They never forget about screening of cancer of cervix.
So the basic needs for a doctor.
And I would like to say, geography make the history. If our Manipur happened to be a flat land, perhaps things could have changed. And unfortunately, still you think of Parbung and Henglev and Kasong Kulen. If you want to bring a patient from Parbung to Surachandpur, where the basic or better facilities are available, it will take around 14 hours. So, but in my subject, when a mother is born a baby, if she is bleeding,
14 hours is like a long time.
But WHO says, World Health Organization say, an unattended postpartum hemorrhage means a woman after childbirth is bleeding. If it is not attended by a doctor like me, she will die in 2 hours. In her hand, she has got only 2 hours, but the road is 14 hours. That too also vehicle she have to pay. So these are the difficulties in the remote areas. But the recent National Health Mission introduction of Government of India and our present situation is we have improved a lot. Any woman should get the opportunity to examine by a doctor at least twice or thrice, and they come to the hospital, we pay the money. We pay money for their transport, for their medicine.
But this is only related to family planning?
No.
Oh, for the whole body checkup?
Body checkup, especially pregnant women.
I see.
Non-pregnant women, they didn't get it.
Okay.
A pregnant woman
so that facility is there?
Is available.
Okay.
And India is, I can say very proudly, because you one of the most fastest growing economy. China is right now is a little bit of in the dipping condition, and in health sector, Government of India is spending, education and health we are spending a lot. But the issue about in our Manipur is the terrain, the road.
So what you're saying is the facilities available in the valley but not in the hills.
Exactly.
So why is this?
No, because of the roads. Of course.
No, but aren't there any in the main district like
No. In the main district nowadays, the cesarean section started doing it at Surachandpur, at More, at the Sandel. Ukhrul, they have started it very nicely. So in my time, I had to struggle at Kaksing at 1990s. I have to do my anesthesia myself, do the cesarean again, do the deliveries, and stitch also. It cost around 250 rupees in my time.
So you were the only doctor attending for a C-section?
Yes. In those days, National Health Mission was not there, but I was looking after about from Sugnu to from Mayang Imphal, and from up to More, I was looking after, because I was there for 24/7, unlike I'm sorry to say young doctors who went once a week, but I, with my bag and baggages, I sleep there, I stayed 24/7, and I was doing it. But now the government of Manipur is giving facilities to the district hospital at least. But I tell you again, because the remoteness is the issue, not the technical issue, not the doctor's issue. At my time, there's a technical issue was there, but technical issue.
Right now, we are in par technically. We have the equipment.
Yes, exactly.
We have the expertise.
Yes.
But we don't have the doctors available in the remote area. So the villagers who are far away have to come in the valley or in the main district, which I mentioned, like Churachandpur, Ukhrul, Thoubal.
Yeah, because in the valley area, we don't have much problem. In the valley area, we don't have much problem. The issue is something like Mao, something like Tadubi, something like Wangmata. But you know, I sometimes felt we in the valley areas, you know, sitting in a armchairs and speaking in a very vocally, we are united, we are all, we are similar, but it is not so. It is not so.
So you see the huge disparity in healthcare and particularly women's health.
Exactly. Because I told you,
because at the end of the day, the women suffer, like they have to come all the way, and there must be many women folks who are not able to even come and get the facility.
Because I told you earlier, because I travel all the health center of Manipur, I have seen it. Of course, the improvement is going on, but it is not up to the mark. Because I told you, because for around 100 pregnant women in Manipur, 30% of the women say, I never ever liked this baby in my tummy. I could have done abortion, perhaps I could have used the family planning. This is called unmet needs of the society. So in our research, in our the National Family Health Survey, around 30% of the pregnant women are never ever like to have this pregnancy.
So they wanted to do abortion, but they have crossed the phase.
Crossed it. And yes, some of them many are doing abortions. Nowadays, I feel very uncomfortable to say it because the over the counter, you can get the abortion medicine, mifepristone, misoprostol for 10 days, 15 days. Again, all the primary health center, even Kakching, Thobal, Moirang, Chanpur, Tadubi, Mao,
So are these prescription drugs?
Yeah, this
or it is over the counter?
Oh no, it should be prescribed by a doctor.
Okay.
But
and it is legal.
It is legal by the doctor.
Okay.
But it cannot you just go to pharmacy and buy it. It is illegal, but still it is. In India we can do that. Even
That's what you're saying is, yes, legally you have to have a prescription.
Yes.
But we all know that
Yes.
like people can go to the pharmacy and get that medication. So just so that I'm clear, in India and in Manipur, abortion is legal.
Abortion is legal.
Okay.
Abortions, Government of India allowed, because family planning and abortion we start very early. India is the first country to establish family planning in Bombay. So Family Planning Association of India is the oldest family planning organization in the world. But very strangely, I thought, because I'm just giving an example, my daughter Mr. Suchi, she is conceived, and I asked her to buy some progesterone to support to get a healthy baby. No, I cannot get it. I have to consult a doctor. So she have to wait 10 days to get an appointment to the doctor, and then only a few days back she got an opportunity to buy that good medicine. There is something like vitamin. To get a vitamin in America, you have to have a good prescription, original prescription. Then only you get it. But here, just on the contrary, this medicine should be available only after the prescription of doctor, but still you can just go and buy it. So there's a thing. Again, that abortion coming back, again abortion is rampant, is going on because of the so-called the non-state actors, or they ban the family planning operation right now in valley areas. So the women
who is banning it? Civil society?
So civil society is so-called the non-state actors, so on and so forth, because we need more population to at par with India, or so on and so forth. It's a little bit political, but it's definitely there is some force.
So what is the percentage of abortion in Manipur?
It's a percentage. I think it will be difficult to say to me, because it differs from area to area.
But in your experience, like, is it
maybe a very simple term, average woman in Manipur at the age of 40, she have done 2 or 3 abortions in their life. 2 to 3 abortions.
So that is very high.
Very high.
So is there, like, not to reveal identity, but just to get an idea, is it only married women or young
very good,
girls?
very good. Unmarried women also come, maybe around 5%.
Okay, so there is a low percentage of that, and most of them are married
and
settled, but it was unplanned.
And there was maybe 4 to 5. Actually, I didn't do a survey, but I'm just assuming myself. But abortion is legal in India by Government of India is very liberal in family planning and abortion. But abortion, according to your John Hopkins, Baltimore, Maryland, abortion population bulletin, abortions service should be available in the community. Abortion service should be available in the community. A safe, hygienic, trained doctor should be available. But it should not be used as a family planning methods. So, in other way,
medically used. If there is a medical necessity, use it.
Yeah, because sometimes threaten abortion, because the woman have got only 5 children. She conceived, but somehow small bleeding is started. When we see the ultrasound, baby is still alive, but there is bleeding going on. So I don't like this baby, kindly take it out. Okay, fine, we do it. Number 1. And number 2, coming back to that, the number of abortions, if it is increased, it is telling that that particular area is not getting the service of family planning. Abortion is the indicator of failure of family planning services of the community. So now our so-called the activists and this thing, they obstruct, don't do family planning operation. So we don't do it in the valley areas. But the woman is conceived. So there is no way out. She come to the primary health center. They spend 400 to 500 rupees or so. They will do the abortions. Nobody can prevent it. Doctor, you will get a little bit of money, perhaps, and the woman is satisfied because she doesn't like this particular baby. So my whole intention, my whole point is that abortion should be available, but it should not be very randomly. It should not be done.
So if I understood you correctly, what you're saying is family planning operation is banned.
Yeah.
But abortion is allowed.
Allowed.
In the valley.
In the valley.
In Manipur.
In Manipur.
Right now.
Yeah.
Oh.
And
but in the hill.
In the hills, no issue because
But this is by the civil society.
Something like that.
Okay, but the government of India allows family planning, surgery, or any other procedure, and also allows abortion.
Yeah.
Okay, so is this recent?
No, it's because I told you, because my lifestyle with family planning from 80s, still I'm working it. At some point of time, I was in Moirang, I was doing more than 100 ligation in a day. I was very happy, a young boy, young doctor. Oh, I have done a century, but that was wrong because I should not do more than 25. Because government there says if you do more, the chance of complication may be there. You may not be doing well. The quality it was compromised. Because I was keep on doing. Yeah, oh yes.
Right.
So quality was, but there was not this restriction also. But now the government came very clearly, 2 instruments with 1 surgeon should not do more than 25. Very simple. Per day.
Okay.
You start from 9, continue to 5, do slowly. Very precautionary, take exam, BP, everything is hemoglobin, then SIV testing, counseling.
But at that time you were doing lots because there was lack of skilled professional doctor who could do that procedure.
Yeah, because I told you, because we only 4 doctors was trained.
Right.
And I feel crying in my heart because only 1 young doctor is coming up at RIMS. Not in our state. Suppose tomorrow morning I have a paralysis, then stroke also, then the only available doctor is lost. And I requested my government that.
So right now in Manipur, you and another doctor
young boy at RIMS.
What is this procedure called again?
A laparoscopic tubal ligation operation.
Okay.
It was started.
And is this the only procedure used for family planning for women?
Yeah. Laparoscopic tubal ligation is easier. With the instrument costs around 4-5 lakhs, and one have to be expert, post-graduate expert. We can do in a male also, no scalpel vasectomy, no cut, no bleeding, no stitch, because I was trained, because I am a double agent. I do for male also, I do the for female also. And we have got other IUCDs, condoms, oral pills, and morning after pills, injectables are available. But very popular is this laparoscopic tubal ligation, which I was doing and I still doing.
Okay.
Number 1. Number 2 is the IUCD, insertion of IUCD inside the uterine cavity. That is going on. But this is a temporary method. But the once ligation is a very permanent, very safe, very comfortable to the woman also. She doesn't require to check again and again whether my string is available or not, whether my property is gone up to the abdomen or stomach, sort of a thing. But ligation was very simple, very enjoyable, very safe, and a little bit of money also to the accepted to the woman. But
the government is
giving.
Yeah,
but it is not forced.
Right.
Government of India is a.
It's the reproductive right for the woman. Then they can opt for it.
But unfortunately, it is lacking. Reproductive right of a woman in Manipur now was hijacked. It's still hijacking because in Valley, a woman cannot do sterilization operation by her choice. That is the most unfortunate
So, I mean,
part.
when you say it's banned by the civil society, but when they come to the clinic, like, how does that work? How does the banning work?
Yeah, earlier, because I went to Moirang,
right.
I went to Lilong. They will gather around 20-30 women.
They have a camp.
Yeah,
and
they will
they
camp.
would all
they will give the money. We will give the medicine also. And another very important, which is very, very painful to my heart, is that when we do camp, the women who never ever get the chance to examine herself by a doctor, we are putting some instrument, seeing the mouth of the uterus, whether the cancer is started or not, whether some difficulties there or not, whether the tumor is cancerous thing. Of course, not only family planning, there's a wonderful, wonderful opportunity to see and to diagnose other diseases also. That part also totally losing to these women. And the cancer cervix is one of the very common, of course now it is reduced, but when we go to the camp, we see the cervix of the woman, the mouth of the uterus of the
So
woman.
what you're saying is, like, as part of the family planning,
Yeah.
some of the women get to see a doctor for the first time in their
Exactly.
life, and if they have some disease or some other things, that time you get diagnosed by accident.
We can catch hold of that particular woman and we refer it and we'll do it free. This sort of opportunity.
So now all the camps and everything is
cancelled.
banned.
Ban.
And from
Blanket ban.
From which year it is?
Must be around 10-15 years.
Okay.
Of course, we keep sometime. Some people come to RIMS, some people come to JNIMS. In an institution, big institute, they will come. We will do it. But I cannot go to Moirang or Thobal or Bishanpur.
You can't hold
camps.
Okay,
Because
so
we are
it's
reluctant also.
I see.
Because the so-called they talk with the arm and ammunition. We talk with the stethoscope and the syringe. So difference of weightage is there.
So this is a very big concern.
Very big concern in my heart.
For you seeing the condition of the woman.
Exactly, because I'm really women right activist, so-called. I'm very happy because you come here, and this is the point which I was struggling to talk to you for the last so many months, because the poor women are crying because they could not get the opportunity of their reproductive right, their basic right.